Welcome to ALH 3, Chapter 25, Respiratory System Disorders. Learning objectives for this chapter, briefly discussing the respiratory tract as a source for internal and external respirations, describing the effects of the antihistamines and decongestants, and the use of nasal preparations with respiratory conditions, briefly explaining the need for corticosteroids in acute and chronic respiratory tract diseases and associated side effects of long-term therapy, discussing mucolytics, expectorants, and antitussives and their effect on respiratory secretions, explaining medical inhibition of influenza, describing medications for respiratory syncytial virus, providing patient education for compliance with medication used to treat diseases and conditions of the respiratory system. This can be found in your book. It's easy working knowledge of indications and side effects of common symptoms of respiratory system disorders and the common side effects of the medications for the respiratory system disorders. There are many classes of drugs to treat respiratory tract disorders. They are available in prescription and over-the-counter strengths, and it is critical to ask female patients if they are pregnant. Some common symptoms would be chest pain, sore throat, difficulty breathing, acute or chronic cough, dysphonia, fatigue, malaise, chills, fever, headache, hemoptysis, and epistaxis. So how do respiratory tract disorders produce these symptoms? When pulmonary disease occurs, the secretions collect and form excess mucus, which then results in difficult breathing and the symptoms listed above, and not all symptoms, but many of the symptoms. Some common side effects of the respiratory tract medications can be dry mouth, tachycardia, sleeplessness and nervousness, nausea, vomiting, anorexia, stomatitis, drowsiness, hypotension, and decreased coordination. Okay, here we see the respiratory tract passages. You can find this in figure 25.1 in your book, and this shows not only the upper but the middle and lower tracts as well. How does respiration control body functions? So the respiratory system carries oxygen to and removes carbon dioxide from the lungs and cells. Although the respiratory system may be affected by voluntary controls, the final control comes from involuntary means. What conditions are treated with oxygen therapy? So oxygen therapy is used to treat inadequate oxygen intake due to respiratory conditions. It is delivered by mask or nasal cannula, and it is ordered in liters per minute. Never use oxygen near an open flame. Some early signs of oxygen toxicity can be mental confusion, aching and burning in the sternal area with a dry and hacking cough. And what signs of oxygen toxicity might follow later after these early signs? That would be respiratory distress, nausea, vomiting, restlessness, twitching, and loss of feeling, as well as tremors. This just demonstrates the two. This is the nasal cannula. This is the oxygen mask. This can be found in your book if you want to look more closely, and we will be learning both types. So allergic rhinitis. This is the most common of allergic disorders. The symptoms include sneezing, epistaxis, runny nose, dysphonia, itching, congestion. In fact, I don't know if you can tell, I've had to pause a couple of times right now. I have been having allergic rhinitis and I have been sneezing, so I apologize if it's been picked up on the lecture. A histamine is a chemical found in the body tissue. It protects the body from environmental factors and from producing allergic reactions. The histamine causes vascular dilation, and you treat with antihistamines, decongestion, and nasal preparations for allergic rhinitis. So what is the role of histamines in the upper respiratory tract conditions? The principal actions of a histamine is vascular dilation and contraction of smooth muscles of the bronchial tree and gastrointestinal tract. Allergic rhinitis is caused by a histamine release. Non-allergic rhinitis is often a symptom of the common cold. So antihistamines, what are they? Well, they are complete with the histamine. They block H1 receptor sites, and they relieve coughs, colds, motion sickness, rhinorrhea, sneezing, and itching. They're not for nasal or chest congestion. They can cause dizziness, drowsiness, photosensitivity, and headaches. And second-generation agents have reduced the sedation side effects. So even 10 years ago, you're looking at Benadryl. When you take Benadryl, you are going to have that sedation effect. Now, if you take, say, Allegra, that has definitely reduced. And again, it depends on the patient and the chemical makeup of your body, but there is a difference, and it has been reduced over time. Allergic rhinitis is the most common allergic disorder and is treated with antihistamines, decongestants, and nasal preparations. And what are the greatest concentrations of histamine? Where are they? They are in the skin, the gastrointestinal tract, and the lungs. These are the organs most frequently exposed to environmental toxins and requiring protection from the associated damages. Here you see a list of common antihistamines. You've probably seen many of these, Benadryl over the counter, now Allegra D, Zyrtec, Claritin, they are all now over the counter where they used to be prescription. Decongestants. So they're vasoconstricting agents that shrink swollen mucous membranes. They come in nasal or oral preparations. They can cause tachycardia, nervousness, restlessness, insomnia, blurred vision, nausea, and vomiting. And I know for me, that's something that I have really had to take note of, especially the tachycardia part when taking decongestants. So it's important to watch out for that. Patients with heart disease, glaucoma, or prostate cancer should use only with the physician's advice. Most oral agents are medications that mimic the effects of the sympathetic nervous system, elevating blood pressure and causing heart dysrhythmias. It's important to note that when using nasal spray, overuse or continued use can cause rebound congestion. So the patient needs to limit the use to a total of 5 days or less. Topical decongestants act rapidly, and oral decongestants work slowly. They can be used in combination with antihistamines to help treat the allergic rhinitis. So rebound congestion may occur within just a few days of constant use of the decongestant. So it's important to educate your patient on the signs and symptoms and what to do if this occurs. Here again, we see common decongestants, and a couple of these you've seen over the counter, and then some are prescription. Have you used decongestants before? Do you have these side effects? What do you think the dangers of using decongestants on a regular basis might be? Well, the biggest danger is the patient may develop habituation with use on a prolonged regular basis because they get used to not being stuffed up, and every time they start to feel it, they continue the use, and then it becomes a habit, and that is not good. So here are some miscellaneous nasal preparations, and It's important to note nasal stinging and burning can occur with the topical nasal products, and so you want to address that with the patients. You also want to educate them not to touch the nasal medication applicators to the nasal mucosa, and that they need to be cleaned after each use with some type of alcohol wipe or alcohol solution so that we don't continue contamination and cause infection. Here is the table 25.3. This shows miscellaneous nasal preparations, so you can take a look at this in your book. All drugs listed here are prescriptions. So combination products. These are products that contain multi-drug formulas, perhaps with unnecessary drugs for the condition. So it's important to look at this. I know so often we go get a cold product, say, and it has medication that we don't even have symptoms for, but because, oh, it's the cold product, we need to take this one. So it's important to read labels and understand what multi-drug formulas contain. They contain antitussives, decongestives, and analgesics. They're used with the common cold. Avoid analgesics and antipyretic combinations with viral diseases. And they also can be subtherapeutic, and this is a disadvantage. So we need to make sure that if we're using a combination product, that we have the symptoms listed and that we need all of the different types of medications that are contained within. So again, some contain several drugs that may be completely unnecessary for us to take. Make sure to select a product that treats the correct symptoms. And a brand name product may be reformulated and sold under the same name. Thus, the patient may buy a product with different ingredients than the earlier product. So reading the labels, understanding what drugs are in these combination products, and matching with the symptoms that we need, and educating our patients on reading the label is very important. So what is coughing? So coughing is a reflex that's stimulated by the CNS and the PNS, and it stimulates the respiratory muscles. It can be beneficial for removing foreign matter, clearing airways, removing excess secretion. A cough can be dry or it can be productive, which means you're coughing things up and it's productive. Prolonged coughing can cause spasms or hemoptysis. And antitussives suppress intensity, frequency of cough while allowing elimination of secretions. So when using antitussives, it can calm the cough and the frequency, but we're still able to actually have some productive coughing where we can expel or eliminate the secretions. Coughing can be beneficial to remove that foreign matter from the respiratory tract. So it's something that obviously needs to happen, but it can be very uncomfortable, and there are ways to lessen the uncomfortable side effects and also treat why the coughing is happening. Antitussives, they can be opioid or non-opioid. Opioids contain hydrocodone and can cause drowsiness, so it's important that the patient know to take care when operating machinery. Also with opioids, we can have vomiting, and so it's important to make the patient aware or check if they've ever had that side effects. Dextromethorphan is the most effective non-opioid coughing suppressant available. You can look on box 25.1 in your book for non-opioid cough suppressants, over-the-counter preparations. So here we talk about patient education for drugs used for coughs. If a cough produces sputum, care should be taken to select an over-the-counter medication that does not contain a cough suppressant. If a cough persists for more than 10 days, or if a high fever or chest pains are present, you must consult a physician.